Hello and welcome to this presentation on Readcoding. My name is Samuel. I am a care coordinator for Phoenix Sunrises PCN and I will be narrating this training video. When scanning on documents, all letters must be scanned on using System 1 Gateway. To scan directly onto System 1, go to Workflow, Document Management, Acquired Documents, and then Scan Images. Then select the scanner which is set up and it will begin scanning through the letters using the setting that you have chosen. Once scanned, the documents will then need to be assigned to a user. Whoever is assigned to a batch will be the only person able to process and read code these documents, unless somebody else takes over ownership of the entire batch. Two people cannot work on the same batch at the same time. To access all letters that need processing, select Workflow, Document Management, and then Acquired Documents. This will show you all the unprocessed documents that are waiting to be read-coded and filed into the patient records. If you click on the drop-down box for Batch, it will show you the different letters that have already been scanned on. Some of these may be categorized into more specific letter types, such as NHS 111 letters, mother and baby registration forms, discharge summaries, and so on. Or this drop-down will just show you who has scanned the letters on and when it was done. To begin processing a document, right-click on the letter that you want to select and choose Process Patient Document. This will open a new window for you to begin read-coding that document. On the left-hand side of the screen, there will be different sections which need filling out with the correct details, which you will obtain by reading the letter. These are patient details, letter details, sender address, and recipient address. Patient details are filled out automatically for most of the letters, but please cross-check this by reading the letter and ensuring you have selected the correct patient in System 1. Letter details include the date of the letter and the type of the letter. On some letters there may be two different dates. Please enter the date of the clinic as the incoming date, rather than the date the letter was typed. The type of letter will usually be written at the top of the document, for example, NHS 111, rheumatology, dermatology, and so on. Sender address will sometimes be filled out automatically, but you will need to double check that it is correct. If not, please enter the correct address or hospital that the letter was sent by. Recipient address in most cases will be the GP surgery, so you would just enter the name of the surgery if it has not already been entered. We will now go through the specifics of read coding and also how to read code different types of letters. The main code that should be added to a 111 report is NHS 111 report received, code XAAFQ. Other read codes that can be picked out after reading the letter can also be added, such as what the problem is, for example, fever, body pain, a fall, etc. If observations have been taken already and are reported on the letter, these should be read coded as well, for example, temperature, heart rate, blood pressure, and so on. With an A&E discharge letter, the primary code used is Seen in Accident and Emergency Department, code 9N19. Other read codes can be taken by reading the examination section or looking specifically at the diagnosis section on the discharge summary. In the diagnosis section, it's important to only ever read code a confirmed diagnosis and never a suspected diagnosis. It's also important to review the comments to GP section in the summary to see if there are any specific actions for the GP to take or any changes to their medication. As with the previous letter, if any observations have been taken during A&E, these should also be read-coded as well. For those who did not attend their appointment, code XAF81 is used to mark on their patient record that they did not attend. For children and babies, the read code used is Child Not Brought to Appointment, code XAB0Q. Read code whether they have been discharged from the clinic due to their DNAs. And for patients on the safeguarding register or those with previous concerns, find out why they didn't attend and then inform the GP. This is especially relevant for children as there could be some serious undisclosed issues. If they do not respond to phone calls, a letter should be sent to the patient's home address, and this will be asking them to contact the surgery so we can find out why they have not attended their hospital appointments. When read coding a cancer screening letter, the coding needs to include the clinic they were seen in, as well as if the result was normal or abnormal. If you're ever unsure about a read code relating to cancer screening, always double check it with a GP. Cancer diagnosis is extremely important as it correlates with the faster diagnosis standard. This is an NHS policy that aims to ensure patients with suspected cancer are either diagnosed or have the cancer ruled out within 28 days. Correct read coding will reduce the wait time between referral and diagnosis. Several different read codes can be picked out of clinic discharge letters. Some of the important things to look out for are any GP actions, any medication changes, and new diagnoses only, not ongoing diagnosis, as they should already have been read coded in the patient's record, and we do not want to create a duplicate read code. If you find any of the above, the letter should be sent to the GP for review so that they can take the appropriate action. You can also read code measurements that were taken in clinic, such as blood pressure, height, weight, pulse, etc. All 2-week weight outcomes and safeguarding letters are to be forwarded to the GP with a red flag. Any letters that do not require GP actions can be filed. However, if you are unsure of any codes, always speak to a clinician to clarify. Do not file. And this concludes the read coding training. Thank you for listening to this presentation. If you have any further queries, please signpost to either your manager or an experienced member of staff, and they will be more than happy to help you. Alternatively, you can review these slides on this presentation as it contains all the relevant information to allow you to successfully read code discharge documents.